So the inguinal hernia symptoms are, one is of course a main common thing is it's a swelling in your groin. So the swelling initially, in the initial days, the swelling comes in the morning or when you're walking, and when you lie down it disappears. But over a period of time, the swelling moves on from the groin onto the scrotum. So once it becomes goes to the scrotum, what was a previously incomplete hernia becomes a complete hernia. Then initially the hernias are usually reducible. That means either by lying down or by pushing it, you can push the intra-abdominal contents back into the abdomen. But beyond a stage, the hernias, as they become bigger and they go into the scrotum, they become irreducible. That means the intestinal contents come out and they are stuck there. So the common symptoms other than the swelling in inguinal hernia, other areas could be a groin pain. So patients can have a dragging pain inside the groin, a feeling of insecurity inside the point, and sometimes inguinal hernias, if the intestine goes inside the hernias, because the attachment of the intestine is stretched, though you have an inguinal hernia, you can sometimes have abdominal pain as well. These are the common symptoms. Sometimes inguinal hernias can have complications. So when an inguinal hernia gets stuck, it's like the neck is very narrow and the contents are very large. So what happens at the neck, the hernia's contents can actually get stuck. So this can present as an emergency called irreducible hernia or strangulation. So irreducible hernia is when the contents are stuck, and once the contents are stuck and their blood supply is compressed, like strangulation, the blood supply of in the neck of the hernia, the contents are compressed, the blood supply to the contents like the intestine or something, the blood supply gets cut off, and then it can present like an emergency with severe pain and redness and features of intestinal obstruction. Like abdominal can get distended, you can have continuous vomitings, you may not pass motion for a couple of days. But something like this occurs, that's a very emergency, serious, critical scenario, because the intestine can become gangrenous and then the patient can go into sepsis and die. So if such a thing occurs, or when a patient with a groin hernia has sudden onset severe vomitings, or the swelling becomes very tense and tender and red, they have to rush to a doctor.